The following program is a paid advertisement for Lithium, the element of stability, brought to you by Cloud County Community College. Viewers' discretion is advised.
Hello, welcome to Lithium, the element of stability. We are very excited to share the project we've got for you today. But first, let me introduce you to our host.
Hey everyone, I'm Mia Sanchez.
And I'm Lacey Duvall.
And you know who I am. I am Nicholas Barotek.
Woo!
Today, we're sharing with you the magic of lithium.
But that's not all. We will be debuting a brand new and original hit song, getting a call from the top lithium expert, which I am personally excited for, and even taking a few of your calls.
But you will need to act quickly because, as you can see, time is running out.
Yes. And for those who are at home and don't know what lithium is, I'm kind of an expert. Lithium is a chemical element, symbol Li, atomic number 3, atomic mass 6.94. It's a soft, silvery, white alkaline.
Nick, you do realize that we're talking about the medication used to treat bipolar disorder, right? Did you even read the script?
Are those lithium batteries in a map of Australia the world's largest lithium ore exporter? Anyway, for those of you wondering what the medication lithium actually does,
Nick, put your hand down.
me and I made a little commercial just for you. Have you ever felt like this?
It might seem crazy what I'm about to say.
Or maybe like this. Don't worry, there's help. It's called lithium.
Swings up and down all in one day. Lithium is a medication used to treat and manage bipolar 1 disorder, especially during manic or mixed episodes.
But there's a little pill that keeps me straight.
It's a tablet you usually take twice a day.
Pop it twice a day, now I'm feeling great.
Because I'm stable, finally got my brain.
Side effects may include ECG changes, acne, blurred vision, dry mouth, tremors, hypothyroidism, fatigue, weight gain, metallic taste, dizziness, restlessness, and more.
Constantly spending my own dough all day. I'm on lithium if you're feeling tired.
See your doctor right away if you feel confused, extremely drowsy, shaky, or very thirsty. These might be signs of lithium toxicity.
I'm on lithium.
Lithium doesn't always play nice with other meds. It may prolong the action of neuromuscular blocking agents and increase the risk of neurological toxicity when combined with calcium channel blockers, phenytoin, or carbenzapine. If you think lithium could help you, talk to your healthcare provider today. Wow, that song is shockingly catchy. Who were those singers?
Honestly, it's got me feeling more balanced already. Does any of this ring a bell, Nick?
So it's not a metal.
Well, it's good we have a teleprompter for you to read off of.
You do know how to read, right? Never mind.
Let's get back to why we are here. Lithium is in the anti-manic agent class of medications for treating bipolar 1 disorders. It was the first drug used for mood stabilizing and still used to this day.
As the commercial showed, according to the National Institute of Mental Health, bipolar disorder is a mental illness that causes clear shifts in a person's mood, energy, activity levels, and concentration. People with bipolar disorder often experience periods of extremely up, elated, irritable, or energized behavior, known as manic episodes, and very down, sad, indifferent, or hopeless periods, known as depressive episodes.
But I know I have one big question on my mind. How does lithium actually work?
Well, I'm glad you asked, Mia, because we have a very special guest calling to answer that question.
But before we get to that, I want to urge you all to call in with your orders because as you see, that time keeps ticking down. You may even get to talk to us on the show.
Alright, I can't wait any longer. I have been looking forward to this the whole show. Please welcome our expert on lithium, Kim!
Hello, Kimberly!
Hi everyone, how are you all? I'm glad to be here.
So Kim, we're all dying to know. How does lithium actually work?
We don't know.
What?
We don't know. There's a few theories. Lithium may alter cation transport in the nerves and the muscles, affect serotonin and norepinephrine reuptake, or even influence second messenger systems. But honestly, science is still figuring it out.
Thanks, Kim!
Goodbye. You three are my favorite students.
We don't know how it works?
Mia is right. Now that we know how lithium works, we can tell you about our options. Remember, you only have a limited amount of time, so call in now to get your very own order of lithium, and we may even have you on our show. I cannot stress this enough. You need to call in for this deal.
Now, I know every single one of you have heard of the brand name for lithium such as Lithbid, Escalith, and for our Canadian viewers, Carbolith, Lithane, and Lithimax.
But don't be fooled, generic lithium is just as effective and way more affordable.
You can get it in capsules, 150 milligrams, 300 milligrams, 600 milligrams, extended release tablets, 300 milligrams, 450 milligrams, and an oral solution of 300 milligrams. Should we be selling this if we don't know how it would work?
And how about that price? According to GoodRx, lithium is only $25.59 for 6,300 milligram tablets. That's a steal!
But you do not have to take our word for it. Let's hear from some happy customers. Tina, who do we have on line 1?
Hello, my name is Megan.
Hi Megan, how excited are you about your brand new order of lithium?
Well, I actually haven't ordered any yet. I couldn't sleep, so I turned the TV on and saw your ad. I think lithium can help me stabilize my bipolar 1 symptoms. I don't really believe in Western medicine and use lots of alternative medicine, such as herbs, essential oils, crystals, and leeches. Will this med be safe for me to use? I just want to know how something works before putting it in my body.
We don't know how it...
That's actually an excellent question. Caffeine-containing herbs like mate, or even coffee may lower lithium levels and make it less effective. And St. John's wort can boost the risk of serotonin-related side effects.
And lithium has its own share of interactions, so watch your sodium intake. Eating a lot of salt, more or less, can affect how your body handles lithium. More sodium, more lithium, as you can tell. So, just in case those crystals you use is sodium chloride, watch out.
You should also consult with your doctor if you are planning to make changes to your diet. So, how big of an order can we expect from you?
Oh, what? While you were talking, I just bought 200 doses off Amazon. Thanks, though.
Is that legal? Is what we're doing legal?
We beg you, if you are going to call in, buy lithium from us.
I think we should take our next call.
Alright, Tina says we got someone on line 2. Hello caller, you are live on lithium, the element of stability. Who's this?
Hey everyone, this is Nurse Nicole. I was hearing your show on my patient's TV and I just had to call in to drop some real-world nursing knowledge.
Well, I thought we were doing a great job, but it is always good to hear from a registered nurse.
Well, I'm not registered, but I do have my 2024 copy of my Davis drug book right here. When caring for someone with lithium, the nurses should assess the patient's mental status regularly, because that's what we're stabilizing in the first place, right?
We were totally about to say that.
And it's important to monitor intake and output, because lithium is processed through the kidneys and any changes in hydration can affect blood levels. Also, don't forget to monitor serum lithium levels so closely. The range is tight, 0.6 to 1.2. And toxicity can sneak up fast. Signs of which we already know because of the commercial with the catchy song.
So, did you like our song?
Well, I said it was catchy, and remember, always give lithium with food or milk to avoid GI irritation. Nobody wants an upset stomach on top of everything else.
Well, is there anything else you have to share with us, unregistered nurse Nicole?
I'm glad you asked. Educate your patients that if they miss a dose at home, they should take it as soon as they remember, unless it's within 2 hours of the next dose. Then they should just skip it. No doubling up.
Okay, Nurse Nicole. I think we could take it from here.
Exactly. Also, let them know it may cause dizziness or drowsiness, so they should be careful of driving or using machinery until they know how much it affects them.
Unless you're going to buy some lithium, we will be moving on to our next caller.
And make sure that your patients use contraception and report to your doctor if you become pregnant.
Goodbye, Nurse Nicole.
We have had multiple callers, a nurse trying to steal our job, and yet we still have not sold any lithium.
Lacey, are you okay?
Yeah, Lacey, I've never known you to be anxious.
I just want everyone to take advantage of this amazing deal before time runs out.
Well, let's take one more call before our time here is over. Tina, who's on line 4?
Hi, my name is Emma and I would like to buy 2 tons of lithium ore.
Woo! See?
That's probably a good idea, Tina. Let's just get this over with.
Because no one should have to ride the roller coaster alone.
Thanks for watching Lithium, the Element of Stability.
This was a CCCC TV production of Lithium, the element of stability. The persons and events in this infomercial are fictitious. Any similarity to actual persons or events is unintentional. No animals were harmed during this production. Please have your animals spayed and neutered. This program was made possible by contributions to your CCCC TV station and from viewers like Tina. Thank you.
It doesn't have to be outraged.
If you think Lithium can help you, talk to your healthcare provider today.